Welcome back. So this is the World Immunization Week going on, and the theme is the big catch. And big catch relates us to something. For example, the people who are living in the low-income countries or the middle-income countries, where are they falling in all of this narrative of the immunization? And obviously, like Shehzad mentioned, we need to immunize ourselves against all of these deadly diseases because A, they are for our own safety, and secondly, we are also transmitting the health to our next generation in the first place. So without any further ado, we would like to introduce our guest and carry forward a conversation on the immunization. We are very glad that we have been joined by Dr. Waqar Hafeez, who happens to be consultant neurologist. Assalam-o-Alaikum, and thank you so much for coming to us.
That too from Maroof International Hospital. Wonderful to have you over here. And alongside him, ladies and gentlemen, we've spoken about it that our society is not based on research.
Yes,
we certainly do not want to look up for options. We do not want to have solutions for ourselves as well. And this segment primarily will talk about research and that too on vaccines as well. So we're very lucky that we have been joined by the Associate Director Research and Vaccination, Dr. Saboora Waris, Maroof International Hospital. That's how she would want me to put it. All right, thank you so much for joining us. Wonderful to have you over here. But sir, let's get started. Obviously, first of all, I would want you, to share your thoughts on Immunization Week and how important it is for the people. And then later on, we will speak about the vaccination and the research behind it.
Okay. So, like in your previous segment, Dr. Saiba was talking about how immunizations are important and how they have been there for a long time, but there's always a research behind it. And these things are always proven with the help of research, and that's how they come into market. And once they come into market, that's when you can introduce them to public and then vaccinate the masses. And that's how it prevents diseases from the masses.
That's true. Okay, so Dr. Saboora, moving to you. So we have seen that Pakistan state is trying to, immunize all of its people, but we do feel some of the challenges. And I think I would like to appreciate our state, Shehzad, for making the universal healthcare coverage, which is very much important considering the fact that we do not belong to a higher income countries, right? And despite the fact the state is still working towards that. So when we talk about the immunization in the Pakistani context, what is the scenario out there and what needs to be done in order to catch up with the theme, which is the big catch, right?
Okay, thank you. Challenges Pakistan is facing is regarding getting the vaccine.
Yes.
There are a lot of misconceptions regarding that, and people are not ready to get vaccinated, and there is a big gap in the clinical research. So vaccines, before getting approved for the human use, they goes into the clinical trials and clinical research.
Okay.
And basically clinical research is about the you are checking the efficacy and safety of the new drugs and new treatments and new vaccines, and
that obviously can be done through research, right? So let's talk about the research initiative because I love it. And it's because that I have to travel for my medical treatments just because of the fact that we didn't have a research hospital over here. The kind of illness I was going through or God forbid was suffering from. Allah ka shukar, alhamdulillah, for giving us this health as well. So why do you think this initiative was taken in the first place? Do you think that it has gained momentum? What sort of research is being done?
So it's basically COVID. We got the COVID in the
world. You've been instrumental in COVID as well.
Yeah. So the world has got the pandemic, that is COVID, and we were lucky that the concept of clinical trial was introduced in Pakistan, and there were lots of trial going on for COVID-19 vaccine. The importance of this is because all the drugs we are taking, all the medicines, all the vaccines we are taking, they are not tested on Pakistani population. We are getting the drugs and vaccines that are being tested in other ethnicity groups.
So is it important to have a particular ethnicity tested against the vaccine, or that vaccine is a universal?
So imagine it's the people in the third world country, Hajra, that that the for example, the developed country will create a vaccine, try it on their monkeys and whatsoever their subject is, they send it to the third world countries, and if they see that the results are better, only then their people are going to use it, and that's something which we all have gone through, unfortunately.
I worked in the clinical trial, and one of the company was claiming that our vaccine efficacy is about 90%.
Right.
And when we tested in our population, it came out to be 60%. Right. So if we are taking the vaccines that are being tested on other population and they are not providing the safety and efficacy in our population, so there is a need to be tested on different ethnicities, and especially in
there's-
Pakistan and developing
And there's
countries.
obviously a problem with the data as well, because we certainly do not get the data. But so
Yes.
you wanted to add over here.
Right. So, adding on to this, so basically, if a trial is done on a certain population, you can only apply the results on that population.
Okay.
And so, if you do if you make the clinical trial international on various ethnicities, you can make the results more generalizable
Right.
and apply to the whole world, for example. So, taking the example of COVID, when the COVID started, every other drug company started COVID trials in different population in different countries, and that's how we have a vaccine that works on everybody. you know.
Right.
So if it were being done only in, for example, in US, the results would be only applied to US population, right? So
Right, so we have seen that there was a pandemic, there was a COVID, and there was a lot of conversation regarding the immunization and mass immunity. And like Shahzad mentioned, that now COVID is just reduced to Khansi and Zukam, and it's not that deadly or
Yeah.
fatal.
Herd
It used to be
immunity,
once. So, and there are a lot of conversations, especially, and you have belonged to the medical fraternity, and you will enlighten us about, so that the world is still vulnerable to another pandemic or the outbreak of another epidemic out there.
Exactly.
So, did we took some lessons from this COVID pandemic? Are we ready for another pandemic if it happens, and especially that in a very fatal?
So this is a constant struggle. You know, the viruses have a tendency to mutate,
Yes,
and
that's
so if they mutate, the vaccine that was, for example, efficacious last month or last year would not be as efficacious for the new mutant. Same thing if you take an example of HIV. Why is HIV still not curable? Because the virus keeps mutating at
That's
molecular level. So that's why we don't have vaccine for it now. Speaking about clinical trials, we have a clinical trial unit at our hospital, and then we are conducting new research on new mutants of virus that can be efficacious for the upcoming or the new circulating viruses that are.
So let's
Right.
address this issue as well. Dr. Saib, I'll move on to you. For example, there's been a lot of conversation around monkeypox now.
yes.
And then they're
Yeah.
saying that there's a new variant of
Yeah.
COVID, and the name is probably urticaria or urticaria. And there, so we have been hearing this news ever since COVID pandemic broke out. Do you think that these units you have spoken about are actually focused, or their energies are focused on it, and then there will be a day when Maroof International Hospital will be announcing, hey, you know what, we have the vaccine for monkeypox, we have the vaccine for the other, God forbid, variant of the COVID as well. Do you think that that's the line of action
And
you
how
guys are working in?
alarmed should we be with the arrival of this monkeypox? Because we've seen that there's a lot of cleaning up going on the airports, and people are all dressed up like they used to in the COVID pandemic. So is it a deadly disease, or what do you call the pandemic?
Okay, so we just emerged from one pandemic,
Yes.
and we may enter into another.
God forbid, yeah.
God forbid. But there is a special
Because the people
instruction.
who have already figured out the vaccines, they really need to sell it to the world now, okay?
So
Let's put it this way as well.
There's economy, right?
Yeah.
Oh,
So
yeah.
currently, Maroof is working on the COVID-19 vaccine trial, and that is a booster trial, and that provide efficacy against the our variants, that is Omicron and Delta, because primary doses we got were not not covering these variants. So we are already doing that clinical trial for that COVID-19 vaccine.
Okay.
If we talk about the monkeypox, obviously at the global level is ready to address this, because WHO is already working on this.
Yeah.
And I think all pharma industries, they have already got emergency approval for the mRNA vaccine that was used for the first time on the human population. Previously, mRNA vaccines were being used for the cancer treatment. There were already a lot of research behind that, but they were not approved. For in the COVID-19 pandemic, emergency use, mRNA vaccines were introduced for the first time. Like, they are produced on different technologies. So Pfizer and other vaccines that
Exactly.
are
There was Sinopark as well, I heard about Sinopark as well. Well, we'll come down to this. There's another thing which I would want to ask you, sir. I'll move on to you, and that is that, so imagine somebody told me, hey, you know what, get yourself a flu shot and you won't get flu. Imagine. So I got a flu shot. After another week, I got flu. How effective or impactful are these vaccines for people from different walks of life? Because you just mentioned, and that's really a correct statement by you, that that those subjects which we have tested and tried our vaccines on will certainly produce the same results on that particular subject or those subjects as well.
Right.
We go to a very different geographical location, it might reap very different results. So how do you think that it varies from people to people, and the vaccine which we might develop, do you think that it will have the same impact as we have seen in order when we kind of refer it to COVID and the herd immunity we got because of these vaccines which were available?
So it's an important question that you've put, because people think that if you've gotten a vaccine, you will be free from the virus, but it's not like that.
Yeah.
It is actually, it reduces the intensity
Right.
and the severity of the disease. And so when the disease is less severe, you are transmitting the disease less often. Okay. So if you're transmitting the disease less often, the general population is infected less often. So this concept is something that should be understood by the audience, that the vaccine does not cure you from the virus. It prevents you from having an intense disease.
Exactly, and so that if you are kind of giving it to somebody else, it will kind of control that as well. Because I studied about it, while we were, God forbid, going through those hard times of COVID. So I think it is referred to as R2, R4, or R6, something of that sort. The R6 means that 6 people can actually get it from you. R4 means 4
In fact,
people.
that's the infectivity index.
Yes.
For example, if you sneeze and you are, for example, sneezing out 10 million viruses, right? So you're sneezing out 10 million viruses in one sneeze.
Exactly.
If you're vaccinated, you may just sneeze out 10,000, for example.
Exactly.
Right.
So you're less infective for other people.
And
So
even if you put your hand on top and then you shake your hands with somebody, please don't
That's
do
a
that.
no-no.
Yeah, that's a sin, that's a crime. But Dr. Saiba, coming back to you now, what other vaccines do you think in near future we might see? Because there was this research article which I read, and it said that in another 20 years our livelihood might increase to more than 100 years as well. And in developed countries we do see that. So one of my wife's Mumani, who actually happens to be in the States, and she's a Gori too, her mother lived for 114 years, and that too with one lung. And she was thriving, she was fit, there was no problem at all. So do you think that we're working on that? We're channelizing our energies on having a better livelihood and a longer lifespan?
Thank you for such a good question. Scientists are working on more vaccines.
Scientists नहीं, हम काम कर रहे हैं. मुझे पूछना सिर्फ ये है. Are Pakistanis working towards that? Why do we have to look at other people and other countries? Now we have a research facility.
This is exactly what we're here for.
Yeah, that's
to
what
tell
I'm
you
saying.
guys that this is something that wasn't there in Pakistan.
True.
For example, if you look at the history, the data till 2021, there were only 133 clinical trials in Pakistan.
True.
And this data is from, I think,
Now you have a trials unit, right?
Right. This data was from 1970s or something. 133 trials in like 50 years, that's nothing. And the jump came in COVID pandemic initially. The trials went up like skyrocketed in Pakistan. That was the impetus behind developing clinical trial units all over Pakistan, and Maroof happens to be one of the new ones.
So I'll let you complete your answer as well.
Right.
So clinical trial global industry is contributing over $50 billion.
Yeah.
The expenditure size of the global industry in the clinical trial is $50 billion.
Yeah.
And the contribution of Pakistan in the clinical trial industry is 0.1%, which is $100 to $200 million. And our neighbors are contributing about $2.5 billion. Wow. So Maroof International Hospital currently is increasing Pakistan's share in the clinical trial industry and pitching Pakistan and bringing Pakistan up front in the clinical trials for vaccines and other treatment trials as well.
Is it the only hospital which is doing so as of now in Pakistan, having for the likes of Aga Khan and other bigger hospitals which do exist over in probably Shifa International? So is your hospital the only hospital who came up with this clinical trial unit, or do you think there are other hospitals as well?
So in the city, Islamabad, Maroof International Hospital is the only hospital.
So in other cities there might be other hospitals?
There are other hospitals as well, Aga Khan.
So they are bringing
Karachi,
us to the forefront as well.
In Peshawar, RMI is there.
Right.
And in Rawalpindi, Shifa Trust is there as well.
Wonderful.
And just to adding on to that, it's just not about one institution, it's about collaboration.
Yeah.
We're also working on national collaboration to achieve a common goal.
True.
And that is to educate the general population and vaccinate to
And
get
I
But
would want
Dr.
to-
Saab, then there's this general debate about it, right? For example, the way we are interacting with the nature or the way our lifestyles are going out, that does tell us something about, how we are getting so many diseases. For example, the way pandemic broke out about the COVID, it was said that the origin is because humans have eaten bats, or they have interacted with bats, and that is why they've put so much pressure on the natural ecological system that we are getting these pandemics. So obviously that's a very reactive approach working on the vaccines, yes. But more proactive approach would be the way we should change our lifestyle patterns. Do you think that this is the right approach to that?
This is something not proven.
Okay.
This is
But
to
there's
date
something
a
which has
myth.
been seen, we've seen so many people just
You might
across
have
the
seen
border
eating.
eating so many things, yes.
You might have seen eating them,
Yeah.
but it's something that is
Yeah,
still a
obviously.
theory.
True.
Still a
Okay,
theory.
it's
It's
not a
something. So
scientifically
origin
proven,
of this virus is unknown.
Right.
So to date, and there have been various theories and
She
whatnot.
follows
the
Trump
lab
quite a lot,
theory and
Right,
yes.
lab theory and whatnot.
Yes, yes.
So yeah.
So one last thing, and that is that first of all, I would want to appreciate you, your hospital, and the entire staff for doing so, and there's a reason. So imagine, Hajra, that that this medicine which I was supposed to take, we call it Tasigna over here. It was by Novartis. So it was being imported by the government.
Okay.
So for the welfare of the people, because nobody could afford it over here. So the monthly dosage would somewhat around cost you 800,000 or 10,000.
God.
So it was Punjab government which actually stepped in, and it was under the auspices of Muhammad Shabazz Sahab when he was the chief minister. Now, alhamdulillah, he's the prime minister as well. So imagine, I'm actually looking forward to a day when that medication will be produced within Pakistan
Yes.
by Pakistanis.
Self-sufficiency.
And let's not wait for the license to be out there,
That's
because
true.
they have earned their money out of this
Exactly.
medicine as well.
True.
I would want people to come up, at the forefront of research and have their own medicine.
Yes.
Hey, you know what? It's treatable in Pakistan as well. We're
Yes.
producing this medicine,
Yes.
and you're on the right path. Thank you so much. Congratulations, Maroof International Hospital. But there's one last question. That is, sir, why do you think that we really need to call International Hospital? Why do we call it International Hospital? I mean, every hospital you go to, they say name and then International Hospital. But why Pakistan mein international
Because
local hospital kyun nahi?
Because we are people, we belong to third world countries, and we still need to decolonize
Let
our
them
minds.
answer that first,
And
then
I'll answer that.
Okay.
And they say that whenever there's an international or something related to that, so they have the more trust develop on it. That is my answer as an audience. So yes, Dr. Saab.
I don't really know the answer, but I'll say anything outside of Pindi is international.
Outside Pindi is international. Anything inside Pindi is international as well. Look at your bhai, yaar. Come on, I'm from Pindi. See, I think international because they provide us with international facilitation, and we really need to take it normally, because I think these basic facilitations should be out there
Yes,
for
that's
everybody. Ladies and gentlemen, we are observing the immunization week. Please make sure that that you share it with your loved ones.
Yes.
Send the link. It's on YouTube as well.
Yes.
Please make sure that you advocate
Yes.
for the better lifestyles of our future generations. Until next time, look after yourselves. 1, 2, 3.
Good
Good
morning.
morning. Thank you.